Thank you guys for spending a Tuesday afternoon with us, and hopefully you are on here to hear about implants because that's what we're going to be talking about. So let me get my screen ready. All right. So my name is David Kirkpatrick, and I'm one of the surgeons here at Florida Dental Implants and Oral Surgery, and with our New Teeth Now procedure. And that's pretty much what we're going to be focusing on and spending most of our time. So a little bit about me, just so you guys have an idea who you're listening to. And I am going to go back and forth between, you'll see me live, especially when you guys are asking questions. I'll try to put my camera on where it's showing me, responding to your questions. But a lot of it, if I do that, it shrinks down the presentation, and there's a lot of before and after pictures and some videos that I want you guys to be able to see really well. So I'm going to keep myself hidden and my camera turned off until I need to show my face. And we are doing this a little differently, as everyone knows, with the COVID-19 virus. We're trying to keep everything as still with, some social distancing. And, at the office, we're doing a lot of different things, which I'm going to show you a short little clip of video, how we're keeping you and your family safe, and we're keeping us as the surgeons and our staff and their families safe. There's a lot of things that we've integrated into our office and the way we're doing things. Now, I hate to say this, but I think it is going to be the new normal. So it's just something that we have to deal with. But anyway, so I'm originally from Kentucky. I did all of my school at the University of Kentucky, and I did my surgery residency at the University of Florida in Jacksonville, and that's how I ended up here in Lakeland, Florida, doing what I do. And probably the most important thing that you're going to see on this slide, and probably a few slides, is that I'm a board certified oral and maxillofacial surgeon. That is very important, whether you do come to see me, which I hope you do, or you choose to have treatment somewhere else. Make sure that your provider is board certified. That's the only way that we can really not police ourselves, but we make sure that we're up to standard of care and above standard of care with everything that we're doing. So I'm going to show you a quick little video that just overviews what we're doing at our office now that we're into this new coronavirus. Caring for yourself and others hasn't been easy lately, but we want to remind you just how important it is to care for your smile.
At New Teeth Now, we're ready to help, and we're taking every precaution.
We're practicing social distancing and checking everyone's temperature.
All of our employees are wearing masks, and during procedures are in extensive personal protection to keep you safe.
Now's the time to get the smile you've always wanted. Call to learn about our specials and visit newteethnow.com.
Okay, so there you go. So we'll jump right into the dental implants, and now you can definitely be safe when you come to see us at our office, because we're making sure that everyone is checked out a little bit before we even get you in the consult room. So it is a very safe environment, and we are cleaning everything. We always kept everything clean, but now we're on top of that and doing that even more. Because it is important that we keep you guys safe. So dental implants, they are recommended by our National Association as the best way to replace missing teeth. And for those of you that do not know, this is what a dental implant is, because a lot of people get confused they think an implant is the tooth, but an implant is the silver structure that you see there that looks like a screw. And what it does is it goes down into the bone. Sounds bad, but it's not. It's actually a pretty easy thing to do, easier than getting a tooth removed. And it gives us or your general dentist a platform or a foundation to build your tooth on that you see and use. So what we do with our New Teeth Now procedure, and this is what we're going to be talking about the most, is this. It's a clear model so you can see the implants, and it's showing 6 implants, which is pretty much what I always do on an upper jaw, which is the maxilla. But I put 6 implants in the maxilla, and that enables you to have significant amount of support. So not only can your teeth look really good and feel good to you, but you can use them to chew and eat pretty much anything that you want to. The lower jaw, done very similar. Usually my protocol, and on my patients, about 90% of the patients I do this procedure on get 6 implants on the upper jaw and 4 implants on the lower jaw. Sometimes I do 5, sometimes I do 6 implants on the lower. It all depends on how much space each patient has in their mouth and how much bone. And there's several different structures that we look for and avoid on the upper jaw and the lower jaw when we're doing this procedure. And that we talk about when you do come in for a consult and we sit down and kind of go over your CT scan with you. I basically plan the entire surgery just talking casually with you, looking at your CT scan. So I'm going to show you a lot of before and after pictures, and I think it's really important that you know that every picture I'm going to show you tonight, every video I'm going to show you tonight, they are my personal patients. So they're not patients out of a book, they're not patients off the internet. These are real people with real concerns and have had real surgeries with me. And I'm going to show you their before and afters, and I think it's great to hear from them what they went through at our office when you hear some of their testimonials. But if you look at this guy, you know, he's missing a lot of teeth. He had periodontal disease, he had decay with a lot of the remaining teeth that he had in his mouth. And he'd been told by a couple different general dentists that he needed to have all his teeth taken out and have upper and lower dentures fabricated. That's something that he, no way, shape, or form wanted to be a part of. He didn't want anything that was removable. He didn't want anything that was big and bulky like a denture. He wanted something fixed that could give him, you know, basically as close as you can get to having healthy, natural teeth back that would look good and that he could function with. Another one of my patients, and she, you know, she's kind of special to us at our office. She had a very kind of a dramatic story where she was involved in a automobile accident when she was younger, and it pretty much broke out all of the teeth, but her roots were left there. And her general dentist, for some reason, left those roots, but it ended up being one of the best things that he could have ever done for this lady. He made her an overdenture that kind of snapped on to the remaining teeth that she had and replaced the, you know, the broken teeth. But what that did is the roots maintained, by leaving them in there, it maintained the bone, and the bone never really had a chance to shrink down. So she had absolutely beautiful bone for me to use to put her implants in once I did take out her existing teeth. So her before, she was really self-conscious about the way she looked, and you can see, you know, I pretty much I take a lot of pictures, and I try to get before and after pictures of all my patients, and this was her before. She did not want to smile. So when I told her, I was like, you know, Gloria, please, like, I need a really good before picture. And she kind of made that face at me, just an exaggerated, you know, overly exaggerated smile. But that is her after. And that is why I do what I do, to be able to help someone get from that before picture on the left to the after picture on the right, and really have a true effect on her life. That makes all the time and all the procedure and, you know, the time that we spend in a chair together worth it when you can get that result and see how it changes your life. So another one of my patients, and, you know, he's a young guy, and he's had problems with his teeth all of his life. And, you know, he came down actually from Chicago. So he knew that he needed the New Teeth Now procedure, and he knew that he needed this because he needed something we call zygomatic implants. And those are for people who do not have enough bone in the upper jaw, especially the back part of the upper jaw, to do traditional implants. And for whatever reason, there's just not a lot of surgeons in the United States that do this procedure. We happen to have 2 here in our practice, me and Dr. Richards. So, you know, Juan called and he spoke to us on the phone, and he made the decision to come down. We had everything set up, but I want you to hear his story because it's pretty touching, and it's pretty a strong message when you hear him explain, you know, what he's gone through in his life and what happened when he came down to see us.
Good morning. I woke up feeling extremely excited about my upcoming dental procedure. I'll be getting this done at New Teeth Now in Lakeland, Florida, with a wonderful staff and an incredible doctor, Dr. Kirkpatrick. I've been waiting for this for 35 years.
I was born without 12 or more adult teeth. You know, it was very, very difficult as a child. You're always looking down, looking away, and as a result of going through that as a child, as an adult, suffer from depression and anxiety.
Okay, Juan.
Yeah, well, hold on.
Oh boy. Oh my goodness.
They look amazing.
Being in a public setting, being able to meet new people, smile ear to ear, laugh at a joke without covering my mouth, looking down. I know every day I'm going to smile as big as I can for no reason because of New Teeth Now.
Okay, so there is one before and there's one after, and I think it's really important to know that even though he looks that good in that after picture, that is immediately after the teeth were put in. Same day of his surgery. You can still see he's got that little purple mark on his nose. That's one of the markings that I use as a reference point with part of the technique that I use. So this is him. He's, you know, he woke up from anesthesia 3 hours before this picture was taken. The lab made his teeth custom fit his implants, and we put them in, and that's him getting ready to leave the office. Just an incredible difference in one day. So why do people do this procedure? Why do we see patients for this New Teeth Now procedure? Well, the most important goal that patients should have is to restore your total body health. You know, the mouth is a huge part of the body. It's the first thing that encounters the air we breathe, the food that we eat. And, you know, I mean, it's chewing the food that's going to be taken into the stomach. It's, you know, the air you breathe into your lungs, pass through the mouth. And if you think about that, if you've got a mouthful of bad teeth or a mouthful of periodontal disease, then everything is kind of mingling with the bacteria that's in your mouth, and that's how it gets into your body. That's how it can start to affect all the other organ systems, your heart, your lungs, your gastrointestinal tract. You know, pretty much everything is affected if you have severe periodontal disease or significant decayed teeth, and it's something that you really need to think about. Excuse me. We know that it improves your self-confidence, helps you bring out a smile, a real smile, gives you the ability to really eat anything you want without pain, and you're asleep during the entire procedure, which for all of you dental phobes out there, people who are scared of the dentist, people who have avoided seeing the dentist because of fear, that's why you need to come see me. And the postoperative pain level will definitely surprise you. It surprises us. You know, we do give you pain medicine to take after the procedure, but it is very common for us to hear that, you know, hey, doc, you gave me, you know, 15 Percocets, but I only needed to take one. You know, I was fine with Advil or Tylenol. That's really comforting to us to know that we can do all this work and do this big procedure by taking out your teeth and putting the implants in, and it not be that painful after. So one of my favorite sayings that I, you know, usually talk about to patients is, you know, the mouth is the gateway to a pretty awesome creation. And, you know, like we were talking about earlier, it's the first thing that encounters the food you eat, the first thing that encounters the air you breathe. And what periodontal disease does, I mean, you can read all of these, but I think, you know, the big ones are it increases your chance of heart attack, stroke, diabetes, and ultimately, when your body is trying to fight all these other organ system dysfunctions like that, and you throw on a low-grade chronic infection in your mouth like periodontal disease, your body's constantly fighting that. Your immune system is working overtime, always, 24 hours a day. And what that does is it, you know, essentially reduces the effectiveness of your immune system. And we all know that when your immune system is kind of in overdrive constantly, it can shorten your life expectancy. So it's a really big deal, something that we need to pay attention to. And here's what periodontal disease looks like. You know, on the before picture, you can see the teeth. He's got some missing teeth. He's got some decay that you can see, some dental crowns. But if you look really close, those dark yellow structures, and I'll try to get my mouse over there, but you know, this is the root of the tooth. That's root. This is crown, that's root. That's from periodontal disease. That's the bone shrinking down because of infection. And you get all this periodontal disease that essentially the infection just eats away the bone and the gum follows. So you get all this recession. And then it's, you know, that low-grade chronic infection. But what I can do in one day, take out those teeth and basically eliminate the cause of the periodontal disease. The periodontal disease is gone from day one. And this is what he looked like when I was finished. Same day, took the teeth out, put the implants in, put stitches. Those are the little strings you can see. But that is nice, healthy gum back to a baseline of pretty much perfect gum tissue. And it basically resets the bar so he can start all over, really taking care of his mouth and keeping everything healthy. Here's what they look like, you know, it's a couple weeks after surgery. So you can see the tissue is nice and pink and healthy around all those abutments on the implants, the little connectors. But that looks perfect. There's no more infection. Here's his before and after with his teeth in place. And he looks incredible. You can't tell that those are an implanted bridge. They look the way he wanted them to look because you as the patient gets to pick them out. So if you want to be truly healthy, you must restore your oral health. So who's a candidate to have this done? Well, if you have no teeth or you're unhappy with your dentures, if you have a mouthful of bad teeth, a mouthful of severe periodontal disease, and especially if you've ever been told by another dentist, another oral surgeon, a periodontist, any dental specialist that you don't have enough bone for implants, you need to come see me for a consult, because I can tell you that I've been here since June of 2007, and I have yet to come across a patient that I couldn't do because they didn't have enough bone. And we do these procedures pretty much every day. Another one of my patients is before picture. You know, he struggled with making the decision to actually do this procedure or not. And his family, you know, kind of helped push him in the direction to do the procedure. And I'm glad they did, because here's his before and there's his after. And it just, like I was talking about earlier, when you can take a patient in the condition that he was in on that picture on the left, where you can see like this little area here, that is a draining abscess coming from his tooth, eating away his bone, through the gum tissue, draining into his mouth. And you can take him from this to this after picture. That is a huge difference. And you can imagine what kind of effect that has on his life. So another patient before and after, you know, and her teeth look pretty good on the before picture, but because that's a regular denture, it's a removable full denture, acrylic made of plastic. We took that away, threw it in the trash, put implants in, and that's her after with her implants in place. Another lady before with her denture, there's her mouth without the denture in place. And you can see she has no bone. She's had a couple implants placed by another surgeon somewhere else. They were failing. So we ended up taking those out, putting all new implants in, and she had no bone in the upper jaw. She was always told that just get used to your denture. You can't get implants, you don't have enough bone. That's until she met me. And here's what we did. She had zygomatic implants. So we bypassed the areas where you don't have enough bone, put the implants, anchor them into the lower part of the cheekbones, very common, and a really, really nice thing to have in your, you know, bag of tricks that you can use with patients to give them the ability to still have implant supported teeth, and they get to throw their denture away. That's her after. Huge difference in the way she can eat, the way she feels about herself. She brushes them with a toothbrush and toothpaste. She doesn't have to use, you know, Fix-A-Dent to hold her denture in place. Here's another lady, came down from the northeastern part of the United States, from Philadelphia. And, you know, she was told that she didn't have enough bone for implants. And her problem was she had this huge one-piece big bridge on the upper jaw that was failing. The thing, you could just grab it and it was coming in and out of her mouth. So we took that out. She had great bone for implants, zygomatic implants, that is. And that's what these are. So they bypass, you can see how much bone she has in the middle and the front part of the upper jaw, but it drops down, her sinus drops, no bone in the back. So without extensive bone grafting, she can't get implants except for these. And this is what I do. I put these zygomatic implants in, both sides, 1 day, no bone grafting, not waiting on a bone graft to heal for 6 or 9 months. We put these in and get her the implant supported teeth in 1 day. Another patient, literally no bone in the upper jaw, hardly anywhere. Found a little bit to put a regular implant in the very front, but otherwise we call this a quad zygomatic implant case. And this is about as difficult as it gets. These are the patients that have been told by oral surgeon after oral surgeon after oral surgeon that you can't have implants unless you see somebody like me that can put in zygomatic implants. And that's what we did for this patient. And they ended up with a fixed bridge on the top and bottom. I was doing a consult and they were kind of asking about what the teeth would look like and how they get to pick those out. Everything is custom. Everything is custom individually for every patient. We don't have, there's not a, like going shopping, there's not a small, medium, large, and a white, darker and darker shade. It's literally, we have a bank of teeth, different sizes, different colors, and shapes, and you get to pick those out. We have a restorative doctor team that they're really good. They've been doing this for about as many years as I have, and they've done more of these cases than probably anyone in the United States, maybe anywhere in the world. It's pretty much all we do every day, and we're lucky to be based in Lakeland, Florida, where we have the population from Tampa and Orlando and the 2 major airports. So people fly in to have this done. So we're lucky, and that means, so we get to do a lot of these cases and get a lot of experience. With that being said, everything is custom. The implants go in. It's not the same in everybody. They're all in different angles, different positions. Your bone is your best bone and is in a different position than what it would be for someone else. So I use your best bone. I put the implants where they need to be for your teeth, the ones that you've picked out. And you play a big role in, a lot of patients will bring in an old picture of themselves, or they'll bring in a picture of like a celebrity or somebody that they really like the look of their teeth. And they'll say like, hey, I like this person's smile. Can you make my teeth look like this person's teeth? And that's what we try to do. We try to get really close to what you're wanting as your goal. But that's a great question. But everything's customizable. So if you see somebody that has really natural looking teeth, that's because they picked that. I had a patient that was 90 years old, and for pretty much the majority of his life, ever since he's had permanent teeth, he had a gap between the 2 front teeth. And the one thing he told me, and I'll never forget this, he's like, I love everything you're telling me, and I know I need to do this, but I don't want to do this unless you can promise me I'll have my gap between my 2 front teeth on my implant bridge. So we did. That's what he wanted. If you see somebody with really, really white teeth, really, really big teeth, it's because that's what they wanted. We try to do what the patient wants in regards to the cosmetics of the teeth. You get 2 sets of teeth with this procedure. The ones that we put on the same day, they're your temporary teeth. You wear those for 6 months. We want them to look and feel exactly the way you want your teeth to look with the end product. But there's some really good reasons that we do the 2 sets of teeth that make it as easy as it can be for the patients to transition to these teeth and then on to the finals. One of those main reasons is we know your gums are going to shrink after I get you in a healthy position. And so we don't want you to be stuck with 1 set of teeth that really doesn't fit very well in a couple months when your gums totally heal. So we do the 2 sets of teeth. The first set is out of acrylic, and they're easily adjustable. So it's easy for me to make any little adjustments to the bite during that initial healing phase. And then the final set of teeth, which are made out of what I consider the best material that anyone has to make these things out of, is zirconia. It's been around for a really long time. General dentists make single crowns out of this stuff for people who clench and grind and really wear and tear on their teeth. So it's a super strong material, but we now have the ability to mill a full arch bridge that's one piece out of only zirconia. And then it's stained to the colors, so basically the shades that you want the cosmetics to look like. So they're super strong. The company markets to be a lifetime prosthesis or restoration. The honest answer to that is we don't really know. It's only been around for 10 years to be able to do that. We know they've lasted 10 years and they're not showing hardly any signs of wear, which is super promising that they will last forever if you take care of them. But that's what we make the zirconia, or the final set out of, is zirconia.
All right, the next question. This person has actually had implants before, and they wanted to know, they say that they were not working the way they had hoped, and they wanted to know if they were removable and you could place new ones, or are they still eligible for this procedure?
Yeah, absolutely. So even with implants that I've put in on different patients, if it's something that we didn't really jump into like a full mouth procedure right away, and now the patient, something happens with the remaining dentition and they need this new teeth now procedure, we basically treat implants just like teeth. So we remove them, put the implants where they need to be for this procedure, but we treat them just like a tooth. So yes, you can definitely have this procedure. We just typically take the implants out and put ones in where I need them for these specific bridges.
And with the implants themselves, is there any chance of them being rejected?
There's always, nothing's 100%, but implants are close. And that's a really good thing because, with implants across the United States, no matter who's putting them in, from people who do one implant a month or one implant a year to someone like me who does, 3,000 implants a year, that's something where across the United States, the success rate of dental implants are about 90 to 100%. That's really high and really good. So can you reject them or can they fail? Yes. Is it common? Absolutely not. It's actually really uncommon for an implant to fail. But, I've had implants fail. I saw a lady today that had one implant fail out of a procedure that I did very similar to that quad zygomatic case. And, one of the single implants that I was trying to give her just a little bit more support, for whatever reason, the implant didn't take to the bone. So you take it out, sometimes you replace it, sometimes you don't have to do anything. But what I can tell you is I've never had a patient that lost an implant bridge. I've had patients to lose an implant, but never to the severity that they had to lose their bridge.
And we do have a follow-up question to that. They wanted to know about the warranty, if there was a cost if it failed, and of course we cover that under warranty. It's up to 2 years now is the warranty?
So the warranty is for 2 years, and we try to stand behind our work. We feel like that it is a really good procedure and something that is very successful and we don't have a lot of problems with. And it's something that, I try to treat all my patients the way I'd want to be treated. And I wouldn't want to invest a bunch of time and money into this, in a procedure like this, and something fail, and then all of a sudden you're just, oh, well, sorry. That's not the way that I practice. It's not my philosophy. It's not how I was taught. And it's definitely not the way I believe that people should be treated in just life in general. So we stand behind our work and we do warranty these things. If they last you 2 years, the chance of them failing after that is pretty much zero. If an implant's going to fail, it's going to fail within the first year. So we warranty them. Actually, we double that time and do it for 2 years. Okay, so Bethany, she is a young lady who is actually from Kentucky, and she found us via the internet and called, and after multiple phone calls, we had everything set up. She came down to see us, and I want you to hear her story because it's pretty motivating and definitely makes you think about what's really important in life with, when you're complaining about a cavity or a little tooth infection, and then you hear a story like this and how she got to be one of my patients. It's pretty moving. So I'll let you guys watch her video.
I had looked into dental implants before, but I had had so much bone loss from having dentures that it just didn't look doable for me anymore. When I was 8, I got dentures, and it looked awful.
And the longer you have a denture, the more bone loss you have. And when you have a lot of bone loss in the back part of the upper jaw, you either have to go through extensive surgery with bone grafting, and you let that bone graft heal, or you can use zygomatic implants and kind of do everything in one day. We're able to put 4 across the front, and then the 2 zygomas in the upper jaw. And on the lower jaw, I typically do 4 implants for the entire bridge, but she had enough that we could squeeze in 6. It's a great feeling just knowing that in one day, make that big of a difference in a patient's life. Our girl, we all want to see.
Okay. Wow.
They look good.
They look so great. I'd say there's definitely hope. If you think that you can't have dental implants, like obviously you definitely can. Now thanks to Dr. Kirkpatrick, I actually feel free to smile freely and I can eat whatever I want.
Okay, so that was Bethany. And, you know, like people are missing teeth for multiple different reasons. Sometimes it's just pure neglect. Sometimes it's medication. Sometimes it's a medical problem that a patient's had to deal with. You know, people who've had cancer, people who've been on chemotherapy. Sometimes it's smoking, sometimes it's drugs. So there's a lot of different reasons that people are missing teeth or would need dental implants. And sometimes it's just plain access to care. You know, as you know, you're at a point in your life that you don't have the means to or the time to go see a dentist and to take care of yourself. And we've seen pretty much, well, I thought I'd seen everything until I met Bethany, but you know, it was really, really cool to be able to be the one that was blessed to take care of her. But you can see her before and after, and you know, that before picture is the denture, the after picture is obviously her implant bridge. And now she doesn't really have to think about, you know, going to dinner with friends, laughing, her denture may come out, not being able to eat what she wants. You know, it's just something that it's cool to be a part of that transformation. So I do want to spend a couple minutes talking about this New Teeth Now Total Facial Makeover. For those of you that remember the show that used to air on ABC years ago, that Extreme Makeover, well, you can literally have that done here with me, where basically of your face and neck. And, you know, part of my practice is I do facial cosmetics, and that includes cheek and chin implants. And I'm talking about cosmetic implants, not these teeth implants, brow lifts, eyelid enhancements where we do blepharoplasties, facelift, neck lift, liposuction of the neck, lip lift, which is really cool additive to do with some of these implant procedures, and rhinoplasties, which of course is nose jobs. So, you know, this patient came in to see me for the dental implants. She had failing teeth, been told she needed a denture. She didn't want a denture. When she came to our office, she saw a brochure that I do facial cosmetics, and she's like, hey, you know, can you do anything about these sunspots, these dark spots, and some of these little fine lines and wrinkles? And I'm like, well, you know, yeah, we could do a CO2 laser. We could actually do that the same time that I do your dental implants. So in one day, she came in, took her teeth out, got rid of her infection, put dental implants in, did a CO2 laser resurfacing of her entire face, and that's her after, about 2 weeks after the procedure. And that after picture looks like the before picture's younger sister. You know, just, she's got a beautiful smile now, no pain with her teeth, and her face, you can tell all those sunspots, those dark spots are, for the most part, completely gone. And a lot of the fine lines and wrinkles have just smoothed out. It doesn't get rid of everything. You know, it doesn't take you back to like baby skin, but it takes her back 25 years, which, you know, she was really happy with, and I was super happy with her after result. Another lady, if you look at the neckline, you know, the lower face and the neck, facelift with some procedures. Another lady, neck lift, liposuction of the neck, facelift, brow lift. And what I do is I don't want you to look plastic, like you've had true plastic surgery. I want you to look very natural, but just better. And, you know, this young girl had a chin implant, big difference between her before and after picture there. you know, so the thing with dental implants is they're never going to need a root canal. The dental pain is gone. I mean, what a difference between this lady's before and after. You know, all those missing teeth, she had decay on the remaining teeth, and now she's got a mouthful of beautiful teeth that are fixed, implant bridge. She brushes them like natural teeth, treats them like natural teeth. You go to the dentist every 6 months to get them cleaned like natural teeth. And let me talk about that for a minute, because the cleanings can't really get any easier than they are with these. You go to the dentist, they take your teeth out, they just unscrew them. There's no numbing medicine, there's no shots, there's no pain. They take your teeth out, they clean them outside of your mouth, they steam any stains off, they disinfect them, and they put them back in your mouth. It really doesn't get any easier than that. So they never decay, so you don't get cavities on these things, and they're super, easy to maintain, like I was talking about a few seconds ago. And, this is Donna. She's one of my patients. And it's just an amazing before and after picture. And to see the effect that this had on her life was really special to me and the rest of my team here at New Teeth Now. And, it's affected her so much that she volunteers to speak with patients. If you're a patient and you're considering this and you're like, oh, I don't know, or I don't even know if I really believe what Dr. Kirkpatrick said, Donna's a patient that on her own, she's willing, it changed her life so much that she's like, well, anybody that has questions about this or wants to know the nuts and bolts or the nitty gritty with this procedure and the real deal, what I went through, the good, the bad, the ugly with this procedure, she's willing to speak with you about that. And that, I think, says a lot about what we do and what she feels, how we've helped her, not only with her smile and her health, but her overall life in general. So the all under one roof, this is really important for you guys to know, because, a lot of people that, they'll advertise that they do something like this, but then you see a dentist in this office who's going to be making your teeth, and then they send you to the oral surgeon down the street, and then they send you down to the lab, maybe in another town or in another part of the city. Here, everything is under one roof. We built this place. It's like a 16,000 square foot building. It's a large building, but we try to keep that small town. It's definitely got a small office, home style feel to it. And that's what we want. We wanted to capture that. We wanted to keep that. But your consult's done here, your CT scan, the CAT scan of your face is done here. We've got 2 CAT scan machines. Your impressions are done here. My restorative team is here. The surgery's done in this office. We have the lab upstairs. So I can't tell you how much of an advantage that is to have the lab technician or the artist that's going to be making your teeth in-house, that they can come out and see you, see your skin, see the shape of your face, see what your mouth looks like, and talk to you about what you want your teeth to look like. And then the final teeth, they're not made in China, and they're not made in California or another part of the United States and then sent here by mail or UPS. Everything is made in-house, and I can't stress the importance of that. What does that mean? We have quality control. If we don't like it, it does not come out of the lab. It goes back in and they redo it until we are happy with that. So all in one day. Of course, there's a couple of, the consult, everything's not done in one day. You come see me for a consult, we talk about your procedure. There's usually one more appointment after the consult before your procedure, and that's when you come in to have your impressions made, and you pick out what you want your teeth to look like. You meet my restorative team, you meet the lab, and then the procedure is done the next, that would be your next appointment. So the procedure is done in one day. I take the teeth out if you have teeth, get rid of your infection, put your implants in, take impressions with your temporary teeth, and then your temporary teeth are made to fit your mouth that day, and they're inserted that day before you go home. The temporary teeth, like we talked about earlier, they are acrylic, and that's for one reason only, because they're easy to make that one day, so you walk out with teeth screwed into your mouth. They still look very good. Actually, it's what your final teeth used to be made out of before we had zirconia as an option. And then your final teeth are made out of zirconia. So the consult, it's about a 1-hour appointment. You meet with me and one of my implant coordinators. We get the ICAT, which is your CAT scan, and then we look at that thing together and develop a treatment plan. Here are my 2 implant coordinators, Debbie on the right in the black blazer, Shauna on the left in the blue shirt. Both of these ladies have been with us for years and years and years. They're extremely knowledgeable with this procedure. And a lot of times when I walk into the room, it's almost comical because I'll start talking to a patient about the procedure and telling them what I can do. And they're like, oh yeah, Shauna told me that. Or, oh yeah, Debbie already went over that with me. And it's like, okay, am I even needed in the room? But and that's a really good thing because they really do a good job at preparing your patients and going over your expectations before I even get there. My restorative team, Dr. Nafala, Dr. Dibbs, both of these guys are outstanding at what they do. Like I said before, there's probably not a restorative doctor in the United States that's done as much as Dr. Nafala, and there's not one that's done as much as Dr. Dibbs. It's amazing how many of these procedures that these 2 guys have done and the knowledge they bring to the table when I'm talking about like, oh yeah, I can do this and put the implants here. And then, I talked to Dr. Nafala and he's like, oh, but can you give the patient a little bit more support, like in the very front or in the very back on the right, because that would help me make the patient's final teeth. And that's, a huge plus when we can all put our minds together because we're in the same place and, develop the best treatment plan and get the best outcome for our patients in general. And Dr. Dibbs has a short video that talks about the restorative portion.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists, and they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Okay, so I think it's cool to hear from Dr. Dibbs talking about the relationship that he and Dr. Nafala have with the lab and the ability to work really close together and ultimately get you the best outcome for the patient. And the knowledge they bring when they talk to you about when they're taking their impressions and you're picking out what you want your teeth to look like, just getting their expertise and kind of their opinion after you've seen me talking about from a surgical standpoint what I can do for you, and then you hear them talk about from a restorative standpoint. I mean, it really doesn't get any better than that for the patient. So this is my part of my surgical team, and when you come to see us, you'll notice that a lot of people, they've been with me for years and years and years, and we're all, we are all a team, and I can't do what I do without the rest of the team. They really can't do what they do without, having the surgical standpoint. But we're all just as important at the end of the day when those final teeth are placed 6 months after, or, after your procedure. It's nothing, you can never get to that point unless we're all kind of gelling together as a team. And I think that's really important. And, here's our anesthesia team, and, they help us out. They're excellent at what they do. And I love working with Jack and Kim. And, they both got, you can read how many years of experience they have. And this slide is actually probably a year old. So it's, a few years more than that now. But yeah, hey, who better to put you to sleep than Jack Daniels? I mean, come on. This is our office here in Lakeland, and pretty much our entire team. And it takes every one of these people to be able to do, at the end of the day, what we do. So that's, it's cool to see every part of us, even though when you come in, you really spend a lot more time with me or, one of my assistants or the restorative team. You're not really seeing everybody that's behind the scenes, but we can't get our message across. We can't get the advertising out. So you as the patient know what we do without this entire team. And, and Jason's part of that. Jason's here with me on the webinar. Because of COVID-19, we chose to do the webinar where Jason's remotely at his house. I'm remoting in from my house. And I think that's important for you guys to know, because we're taking every step possible. Why would I risk putting me and Jason and a cameraman and, somebody that would host the webinar all together in a room when we just don't have to take the risk, especially with everything going on in the world right now? We try to go the extra step to make it as safe as we can for me and my family, for you and your family as the patient, and for the rest of our team. And that's kind of what we do with everything that we do at Florida Dental Implants and Oral Surgery.
Thank you, Dr. Kirkpatrick. I do have some more questions. Basically, they saw you doing the chin implants, like in the one woman, you did a chin implant that fixed her facial structure, and so they were just seeing if that's something similar they can do that would fix the sunken in look they're getting because their teeth, the bone is missing.
Yes. So there's a couple different parts to that question that you need to know about. When you lose teeth, you lose bone. When you lose teeth and bone, you lose volume of the face. And when you lose that, your soft tissues follow the hard tissues. So if you get a sunken in appearance because you lose your teeth and bone, then your cheeks and chin are going to sink in. Typically replacing, it depends on where that appearance is and what you're concerned about, but typically when we put the implants in and replace the teeth, that restores a lot of the volume. But if we know that you've got a really kind of soft chin, or what we call a class 2, where your lower jaw is significantly behind the upper jaw, then yes, we put the implants in, we put the bridge on, and I do a silicone chin implant like I did on that young lady that you saw. And that basically restores everything back to where it was when you were a lot younger. The same with the silicone cheek implants. I'm not talking about the ZYGOMATIC implants to hold the bridge. I'm talking about for cosmetics, to replace volume that you lose, because when you lose the upper teeth, you lose bone, the cheeks sink in, and that's something that we can really change cosmetically by putting the implants in and put a silicone cheek implant in at the same time. And it's something that really doesn't take a lot of extra time to do. It's a pretty easy procedure. The recovery is no different whether you had that or you didn't have it with your implants, but it makes a dramatic difference. Almost makes you look like, how good Debbie looks. The picture, on the screen, Debbie in the black blazer. I mean, she's got nice filled out cheeks. That's, she's got good volume there, and that's something that we can accomplish with just simple silicone cheek implants, which can be done at the same time.
All right. The person that was talking about the bad implants before was asking if they have those removed, can you put new ones in the same day?
Yes. I haven't had a patient yet that, when we take the implants out or the teeth out or teeth and implants, that we couldn't do the implants, replace them in a different position. And one of the reasons that we typically need to take the implants out for this specific procedure to do new teeth now with the full bridge, those implants typically go in a little bit different position than a traditional implant would for a single tooth replacement. So pretty much even the implants that I put in, say a patient's missing one tooth in the front and I put an implant in to replace that tooth. Now the patient comes back a few years later and needs the new teeth now procedure. I have to take, even though I put that implant in, I have to take it out. It's just one of those things that we want to put them in the perfect spot for these bridges. But yes, they can definitely be done the same day.
All right. It looks like we don't have any more questions.
Okay.
If you do think of a question after the webinar, please give us a call at the number on the screen there, the 800-615-5838. It'd probably be best if you call tomorrow after 8 a.m. We do have a few implant consults that are available this week. So if you decided that you wanted to move forward and meet with Dr. Kirkpatrick, please give us a call tomorrow morning and we will work you into the schedule. Thank you again,
Awesome.
Dr. Kirkpatrick, and have a great night.
Yep. Thank you, Jason. Thank you guys for being on here.